The research that I have done that has been related to compassion fatigue centers around this concept called adverse childhood experiences. When I would be giving talks about compassion fatigue, I always got the question from the audience, do veterinarians come into the practice more at risk for mental health issues, or does it occur during the educational process and during the practice of veterinary medicine? And I got tired of not having that answer. So there was this concept in social science called adverse childhood experiences. These are things that happen to children before the age of 18 that put children more at risk for mental health problems, including suicide. And we know that that issue of suicide is a really important issue for veterinary medicine right now. With people who have 4 or more ACEs surrounding child abuse, physical, sexual, and emotional abuse, neglect, and also having a family member with a mental health issue, or family members that are incarcerated or experiencing divorce, are all the kind of adverse childhood experiences. People who have 4 or more adverse childhood experiences have a 12.1 times more likely possibility of having suicidal thoughts or killing themselves. So we wanted to find out, do veterinarians have a higher rate of ACEs than the general population? So our first study, which is coming out soon in the JVME, looked at veterinary students. And what we found was that actually no, veterinarians do have about the same rate of ACEs as the general population, which is 63% of all Americans have at least one ACE. So it's very common. So what that leads me to, so that's our research, looking at why we might be having this issue of compassion fatigue that is resulting in poor mental health and possibly suicidal thoughts and feelings in veterinary medicine. So far, it's not about ACEs, it's not about what happens to kids, although we did find that veterinarians in our sample, veterinary students, had a higher rate of having a family member with a mental illness, 31%, compared to the general population, which is about 10%. So that's very interesting. So we're going to do some more research in that area. But what this research has sparked in me as an educator is that we have to prepare veterinarians in the educational process for what veterinary practice is really like. People, I think, come in with the idea of James Herriot, and it's not like that. They're dealing with the public, and the public is hard to deal with. And so I consider it my job to really prepare our students for what veterinary medicine is and is not. And I think that that can really help protect the mental well-being of veterinarians when they get out. And that's really important to me. I cannot tolerate veterinarians not having good wellness.